I'm Nate Maslak, SVP of Strategy and Growth at H1, formerly the co-founder of Ribbon, and we are here with Guy, the co-founder and CEO of Healthee.
Hey, great to be here. I'm Guy Benjamin. I'm one of the co-founders and CEO of Healthee. Background on me, as you know, I'm originally from Israel, grew up there. First career was very, very different than what I'm doing now. I used to be a fighter pilot in the Israeli Air Force. So I flew F-16s for about 13 years, then finished that, then came to the US back in 2012. Went to Yale and then worked at McKinsey, the consulting firm, for about 7 years here in New York. While I was working at McKinsey, kind of realized that it's probably easier to fly jets than to navigate health benefits. And every time I had a question, I would go to HR, they would send me to a call center. Wasn't really the experience I was hoping to get, but I also noticed I'm just not a smart consumer when it comes to healthcare. Like, I don't know where to go, how much things are going to cost, bills that I get that I have no clue about. And it got me thinking that there has to be a way to kind of leverage technology into this whole space of health and wellness benefits, specifically AI technology. So left McKinsey about 3.5-4 years ago now, and started meeting with investors, laid out the vision of how to bring AI into this space, and then started Healthee. And today we're 15,000 employer groups are using us. We raised about $110 million so far. And I'm excited to be here.
Yeah, thanks for sitting down with us. Excited to chat. Would love for you to share a little bit on what Healthee does. Obviously, we've been working together for a long time, but I think it'd be good for folks to hear it from you.
Definitely, and we have been working for a long time together, and I think it's cool because you get a chance to kind of see the evolution of Healthee, right? I'll tell you a bit about where we are today. Today, we're a health benefits navigation platform, which means we help employees not only navigate their health benefits, but their medical, dental, vision, pharmacy, point solutions, EAPs, wellness program, even policies. And we help the employee all throughout their, let's call it, benefit journey. So we help them during open enrollment. We'll tell them what is the best plan for them and their family. Then after they pick a plan, what are they covered for, where they can go, which doctor, book appointment. We'll connect them to actual providers through telehealth. We'll tell them how much things are going to cost, and we'll help them with billing after they got billed. And then lastly, we also help with pharmacy navigation. So kind of a platform that kind of like does everything I just mentioned, heavily relying on AI. And then the last thing is that we do all of that through an AI assistant that we developed. Her name is Zoe, and she kind of becomes your personal health assistant. She can answer any question about your benefits. So that's kind of what we do.
Very cool. Well, we are also users of Healthee and Zoe. Tell me a little bit about the mission of Healthee, why you all do what you do, and where you are in that journey.
Yeah, so our mission is to help employees be healthy effortlessly, right? Because today, think about how much effort goes into being healthy, right? Like, you need to figure out, am I covered for something? Which doctor can I go? How much is it going to cost me? Can I even afford it? And then you get a bill, and what is this even about? Should I even pay it? So that's our mission, is to really make healthcare or make employees be healthy effortlessly. And I always also add that we're trying to make healthcare as easy as online shopping. And I think what's easy about online shopping, and we all do online shopping, is that it's easy because we know the price, we know the product, we have a description of it, we know reviews, and we even know when it's going to show up at our doorstep. With healthcare, we know none of that, right? Like, we are coming in kind of like really blind into the entire healthcare experience. And that's what we're trying to do. We're trying to give you all the information so you as a user, all of us are healthcare users, right? Just be an actual consumer. I argue that we are not smart healthcare consumers today. Without Healthee, I don't think anybody is a smart healthcare consumer. And we are bringing consumerism into healthcare. And to your question of where we are in that journey, in one sense, we're just starting, right? We just celebrated our 4th birthday, May 1st, a week ago. So in one sense, we're just starting because we're just scratching the surface. But in the other sense, we're very much like in our mission, right? Like, we're helping hundreds of thousands of employees every day to be smarter healthcare consumers. And there's so much more we want to do. There's so many more people we want to get to. There's so many more features we want to add. And we're not standing still. We're just going to keep improving the platform and making healthcare more accessible every day.
I love that. We've been working together for the last 4 years.
Since the beginning.
Yeah, since the beginning. And you've seen our company go through a big evolution. We were a small startup when you took a chance on us. We scaled that company. We've recently been acquired by H1. And now I'm excited we get to kind of broaden and deepen the partnership.
Right.
I'd love to hear a little bit about what H1 means to your product and to your company.
Yeah, so first of all, H1, I think for us, is one of our most important partners, right? Like, we're getting so much of our data comes from H1, provider search, pricing. Now we're going to start looking at even quality of providers. We're not going to add that, but even provider search, when you think about it, it's one of our most used features. We're just looking at one of our customers, it's like couple thousand lives. In just one quarter, they booked 100 appointments with doctors, right? And if they booked 100 appointments with doctor, that means that they probably looked for 10x of that, right? Like provider search, if not 20 more, right? 20x. So it's one of our most important features, but also it's one of the features that we're very proud of because there's always that issue with when we go to a sales call. Oh wait, but if I go to the carrier website, they'll show me a doctor that's in network. I'll call in, they're not in network, right? And we always like to say, well, we're not using the carrier website. We're actually using H1. We probably say H1 in every sales calls that we have because we say, well, we use them to kind of make sure that we show you not what the carrier is showing, but the most accurate data for in and out of network that there is out there, right? And because of that, that gives us a lot of credibility as well. Because when you think about Healthee, at the end of the day, yes, it's an amazing user experience, but we're an aggregator of data. So we bring H1, we bring ZocDoc, we bring a lot of other data to our platforms, and that's what allows us to, first of all, also build this really cool user experience, but also get trust from the user. Because if we show them a doctor or a provider and we tell them it's in network and it ends up not being in network, we kind of lost all credibility, right? So it's something that's super important for us. Again, one of our most used features. So that's why I personally see H1 as one of our most important partners.
Are there like case studies or moments or stories that you're really proud of that you want to share?
For sure, yeah. There's many of them, right? So first of all, we have stories where we just help employees pick a better plan, right? So we have a high percentage of our users will pick the plan that we recommend. And we know that 50% of employees choose the wrong plan, and most of them are overinsured. We have customers where we were able to increase the number of employees that were signing to the right plan by tens, like dozens of percentage, right? Like 10, 20, 30%, which means that we are lowering the employee cost, but we're also lowering the employer cost. One of our customers, which is a very known social media platform, we returned our yearly cost just during the first 2 weeks of open enrollment because we were able to steer employees to plans that better fit their needs, right? So it's just one example. The other one, it could be more individually where we help an employee figure out if they're covered for like a PRP shot for their elbow, right? Because they had a tennis elbow and it doesn't say anywhere if they're covered for it or not, right? We have, unfortunately, even stories where employees were using us because they were depressed or hurting, like threatening to hurt themselves, and we were able to get them help at the right time. Because sometimes you'll try to get time with a therapist, it'll be a month away.
Yeah.
Right. With us, you can talk to a therapist right now, 24/7, and something we actually save people's lives because of this. And there's many of these stories that I'm super proud of. Right. We talk about it a lot within the company, and we're now also trying to kind of promote them as well outside of our kind of like ecosystem, but also like on social media and LinkedIn. But there's so much ROI from it. Like I just posted something on LinkedIn where I kind of basically said, reducing healthcare costs and improving an employee experience are not one against each other, right? Yep. It's not either or. You can actually improve an employee experience with their healthcare and reduce costs, which is a win-win, right? Because if I have better access to healthcare, if I understand better the cost of each procedure, then I'm going to lower my costs, I'm going to get better treatment, and I'm going to lower the cost for my employer. So it's really a win-win, right?
Yeah, that's exactly right. Because costs aren't correlated with quality. They're not correlated with access. No. Quality isn't correlated with access.
No.
It's a mess. And so you're helping people actually kind of see those hidden forces at healthcare and do what's right for them.
Exactly. I mean, we show every demo we show, we kind of let's look for an MRI together. And then we show the person in the demo, we say, look, if you go next to your house, that MRI is going to cost you $600. If you literally walk 2 blocks in New York to another street, you get the same MRI for $50.
Yep.
Right? It's the difference between $50 and $600. The $600, that's not a Louis Vuitton MRI. It's like they're exactly the same, right? But we're just not smart consumers. And unfortunately, every location can charge whatever they want.
Exactly.
Most people don't even know, right? So why should they even change their price?
Yeah, and they can get away with it.
Exactly. So yeah, there's a ton of impact there.
Let's talk AI. You guys were talking about AI before it was cool.
Yeah.
You were an AI first company since the very beginning.
Right.
Talk to me a little bit about how AI shapes your product, where it is today, where you're excited about.
Yes. First of all, AI is in everything that we do, not just in the product, in the company as well. I'll just give you funny examples. Like even when we do an RFP, we build our own AI tool to fill out an RFP.
Awesome.
Same for like, we do dozens of security questionnaires every year because every new customer, we just signed a customer, like a Fortune 500 one, huge security questionnaire. We build an AI tool to fill out that questionnaire for us based on all of our data. So first of all, AI is in everything that we're doing as a company. And by the way, in every department, like the data, marketing, sales, R&D, obviously, we use AI in everything that we do. That's first. And then in the product, that's our core, right? Like if we go, feature by feature, each one of them has their own AI component. So for example, our plan comparison tool, it's not only helping you pick a plan based on, set of parameters, and if you pick those, then you get the high deductible one, right? Like most of our competitors, like if you say something, then hey, take the high deductible. No, it actually takes into account dozens of factors, but also predictive AI models that we built together with actuaries to try to predict what will be your needs in the next year based on who you are, where you are, what are you doing, and try to predict what is the best plan for you, not just now, what will be the best plan for you for the next 365 days, right? So that's just one example. Zoe is a full AI. We use LLMs that she's constantly learning to try to figure out, first of all, what is your need? What are you asking? For example, somebody will go and say, my daughter needs a speech therapist. So first of all, she needs to understand that it's not for you, it's for your daughter, right? And then she needs to understand that you're looking for a speech therapist. Then she needs to go back to our database and find, okay, is this person covered based on the fact? We have 15,000 different health plans that are in our database. She needs to figure out, what is your plan? Are you covered for that? Where can you go? What's the availability? How much is it going to cost for you? Those are massive databases that without AI, we would never be able to do that. And then she needs to provide the answer in a way where, basically we always joke like that a 5-year-old can understand, right? Because health plans are not written in a way that, sometimes even somebody with a law degree wouldn't understand, right? So she needs to take that and make it more digestible so you can understand it. So that's also part of the AI. We're now working, you ask what's next. We're working on AI agents to kind of do stuff for you, right? Like do some research for you or find, I want us to get to a place where at the beginning of the year, an AI agent will kind of like figure out what your needs are and then schedule your entire preventive care for you and your family for the rest of the year without nothing that you need to do except they'll remind you to go get that, either prescription or preventive care or whatever it is, right? So our next kind of thing is these AI agents to go do stuff for you to help you be healthier. And we're constantly thinking about what is the next thing? Where's the next innovation? It's really in our DNA, right? Like we're doing a hackathon, I think next month, just on AI agents. The entire company is kind of looking into what is the next thing we want to do. And I think the other cool thing is that we're always going to with our partners and our customers to ask them, what more do you need? What else can we do to make this platform even better for you? How else can we harness? Because we always say there's nothing impossible. It's just a matter of like resources and time, right? Because when I was in the Air Force, we had the saying where the easy to do we'll do now, the hard we'll do tomorrow, the impossible give us a couple of days. And I think we're doing the same thing here, right? Like we're always looking for what seems to be impossible, then we go do it.
Right. I love that. And it's a testament to the product that y'all have built and the company that you built here behind us too. Guy, this has been awesome. Thank you so much for spending time with us. Thank you for being such an amazing partner to H1 over the years, and excited to see what more we can do together.
It's great to be here. And again, we love the partnership. You've been with us since almost day one, I think, and we really appreciate it and looking forward to what's next.
Cool. Thank you.